Hello, everyone. This is Dr. Khan. I'm going to go ahead and bring my guest on. Just 1 second. All right. Good evening to everyone. Please bear with us as I bring Michelle on. All right. So I'm going to go ahead and add Michelle. All right. There we go. All right. Good evening to
Hi.
everyone. Yes. Hi. Good evening. Good to see you, Michelle. And I just want to go ahead and get some feedback. If you could please text us or let us know that you can hear us. And very soon we'll go ahead and get started. I'm going to go ahead and check my other phone to see that we're on and that we're live. And okay, very soon all right. Having said this, I'm going to go ahead and get started shortly. I'm going to go ahead and check my other phone. So, to everyone, I am Dr. Shaher Khan. I'm a board-certified plastic surgeon. I have Michelle Churchill. She is one of my patients, and I want to go ahead and bring her on as a guest. I requested her to come on and share with us her journey, having explanted with me, and so that we can learn from her. I was very much admired by her homework that she had done, her recognition of the problem, her research that she had done, how she came to me. She and I have just talked very briefly. The details we'll hear from her, such that I can learn from her, and we can also learn from her experience so that we can enhance the next patient's experience and add to their recovery and add to their enhanced quality of life and recovery. Now, having said this, Michelle, if you could please introduce yourself and let us know, and let us, the viewers know, as to a little bit more about yourself.
All right. Can you hear me okay?
Yes, I can hear you just well.
All right. Well, thank you so much for having me. It's such an honor. My name is Michelle Churchill, and I reside in Michigan here in Bloomfield Hills. I know that there's a lot of girls in this group from all over the states, and there's many people who travel in from the states to go to Dr. Khan. A couple of them I have met when they were in office. And I have had breast implants for 14 years. I had silicone and I had them under the muscle. And I got to a point where I started doing a lot of marketing online. So I was having a lot of conversations with a lot of women. And I swear, I'm pretty sure I probably had 100 conversations with people who had been very ill with breast implant illness. I immediately then was referred to Dr. Khan, and I looked at the symptoms chart and I was like, holy crap. So I have been on anti-anxiety medication since I've had my implants, depression medication. I have insomnia. I use stuff to sleep. I had Raynaud's where my fingers would tingle and turn in the grocery stores completely white, night sweats, just a lot of the symptoms. And if this is what it's coming from, I don't want to get these replaced. I want to get them removed. So before going to Dr. Khan, just to put that out there, I did go to 6 plastic surgeons, and 3 of them said, why do you still have these in after 10 years? They need to be replaced. And then the other 3 said, if you're having no complications, just keep them in and let us know when you are having complications. So that's something to consider if you've gone to just one person and they are telling you that they're okay until further notice. So I got with
what was your motivating factor? Like, what was going through your head as, these are, plastic surgeons who are practicing, they're telling you, and obviously you got different answers, and I'm sure, and again, with all due respect to my colleagues, what did any of the plastic surgeons tell you just to basically remove them and not basically have any, or did the 3 just told you that you replaced them, you basically exchanged them out?
Yes, that's correct. Actually, I went to one doctor who told me, do not remove them. You will be flat chested and you will look absolutely horrible.
Okay. Now, please don't mention any names. And again, this is where we want to be as professional and courteous to our, colleagues and to the listeners, so that we all, what we want is to see. Now, what was going through your mind when, remember, you chose what was the option, which was to remove them and not to replace, because what was going through your mind in order to make the decision for someone young like you, who has a lot of followers online, on Instagram, and you actually have, again, when you're young, you want to look the best you can and feel the best you can, and to go contrary to what the system was telling you, what your mind was telling you otherwise, where you said, you know what, you want your health back and all these symptoms that you mentioned. So what was going through your mind where you said, you know what, I'm not going to get them replaced?
So what was going through my mind was that, first of all, I think it's very important for myself to love myself unconditionally, and by having big or small or no boobs has nothing to do with how I should care about myself or portray myself. So that was one thing. And honestly, getting into personal development back a few years ago and reading books on confidence and trying to grow myself with self-love has really helped in making the decision that there's tons. I've met at least 100 women now who have gotten them removed, and I look at them and I don't look at them any differently. And if I know that this can do something and have a negative effect on me, and I don't want to wait until I'm older, because now is the best time, because I'm healthy and I'm young and my skin will bounce back. And I have this group with Dr. Khan where I was talking to women in the group and messaging them and asking them questions, and they were all happy. I never once came across someone who had breast plant illness and had their breast plants removed where they told me, I regret it, don't do it. So
Right. No, very important point. Very important point. If you talk to my patients, almost all of them, if not 100% of them, have said two things. Number one, if they had wished, if they could go back in time, they would not have gotten the implants, number one. And if they had wished, they had removed them sooner, just so that they would have gotten their quality of life back, just like you said right now very well.
And then just lastly, to wrap that part up, it's your mindset. It's what you're telling yourself. It's, if you're telling yourself this is going to be horrible and I'm going to look horrible, it's all a mindset thing. That's how you're looking at yourself. Like, nobody looks at me any different. And to be honest with you, every person, I just had a huge party for my birthday and I told them, and they're like, Michelle, I didn't even know. I couldn't even notice. Like, you
Right.
can't know. So like, it really is crazy to go through the process, to be intimidated, to be scared. Like, if you have any type of tug on your heart to want to explant, all I have to say is go all in with it. It's never going to be that tug like I'm 100%. Like, do it, go after it. You have no harm by doing it. So you might have to work on some personal development, and you might have, like maybe there's some underlying insecurities that you have, but it has nothing to do with how big, small, or what shape of size your boobs are.
I will tell you, the coming from someone young and energetic and lively, someone such as yourself, it means a lot. And you know what? If this is the take home message right now, this is it. Like yourself, love yourself the way you are. You don't have to be this different person. And look, right now, as you sleep every single night, every single day when you're working out, you don't have to worry about a rupture. You don't have to worry about the silent rupture. You don't have to worry about lymphoma. You don't have to worry about exchanging, replacing, along with the many signs symptoms of breast implant illness. You don't have to worry about anything, and no trauma or anything like that. Today I had a lady that came to me in clinic. Today is an unusual day for me to have a clinic on a Wednesday, but I saw a patient in her 39 years of age to be exact. Her 4-year-old daughter came running to her, and instead of hugging her, she actually kneed her mom on the left chest. And she had a lot of excruciating pain. Now she's concerned if she has a rupture or not. And lo and behold, this is something that you don't have to live with, or the trauma of everyday normal life. And this was just a very benign interaction that she was having with her 4-year-old. And you don't have to worry about it, meaning the trauma of potentially hitting while playing basically soccer, for example, the trauma of just spontaneous ruptures, the silent ruptures that occur. So very important point to mention. And again, love yourself the way you are, because that's how God made you. You don't have to go out of your way and hurt your body, because it's all about this, development that you were mentioning, how you had to work at it and tell yourself, I am better than what all of these other doctors are telling me, because I can do this on my own. And you can do. And I have to say, from the time you came in, you were mentally prepared, that you were ready to get better, healthy. You were ready to get, you were mentally prepared to basically move on to your next phase of your life. Now, the next question, how long did you do your research for? Like, as far as choosing your surgeon?
Within 6 months.
6 months, yep.
Within 3 months, like fast. Like I knew when the thought came, when I started talking to these women, and then I was meeting fitness women who who have big influencers and big followers. I'm like, these people can do it. I'm the kind of person where like, if someone can do it, I can do it. Like if I was the first person doing this, that would be a big struggle for me. But we have this group of so many women. If you go through the members, I can see people and they have kids, and I'm like, I can connect with her. I'm going to message her. I'm going to ask her. Oh, I saw this girl posted. Like, I'm going to ask her. So I just asked questions. And like I said, I never one time had negative feedback. If anything, I heard like, I can actually get out of bed in the morning. Like I was in the hospital. I couldn't move. Like there's people getting implants 2 weeks later, getting them taken out, like severely sick people. I mean, so I was like, okay, like, why am I waiting for this? Like I show up every day and I freaking move my body to add longevity onto my life. I show up every day and I'm conscious of what I'm the kind of person where like, so if I care about how I feel, you're
Right, right. No, very, very important. Now, this is where, again, you want to be in control rather than the system, re, how other people are perceiving you. Because this is, if you think about it, essential surgery. This is, if you think about it, non-cosmetic surgery. What is that again, please?
coming in, talking twice. You got to turn their phone off.
Everything is off. I just wanted to see everything is off. There is nothing else on. Can you hear me now? What is that again, please?
To add longevity.
So can you hear me now?
It's doing the same thing.
Okay, this sounds better to me. Is this better now? Okay. All right. Now what I'm going to do is, G, can you hear me better? Okay. Let me try one other thing. I do not know why this would do it right now. Is this better?
No, because what's happening, Dr. Khan, is you're talking and then like 30 seconds later, it's saying what you said.
Oh, really? Okay, so it's resonating. So the connection is not good. What I'm going to do is I am.
Done.
What is that again, please?
Done.
No, there's only one phone that is on right now, and I do not know, the connection is bad. So Tracy's saying, if you have Facebook open and Zoom, it creates feedback. No, there is only Facebook, and I do not know why this is doing this. And so is this better, Michelle, or no? Okay, so what I'm going to do is this. Let's go ahead and wait 10 seconds. If it's not any better, I am going to go ahead and connect again, such that we can reconnect, and hopefully that connection is better second time around. So Tracy's saying that she can hear me just fine.
She is all garbled.
Yeah. So what I'm going to do is, let me go ahead and log off, and I'm going to go ahead and connect again, and I'm going to bring you on again. Okay. All right.